Okay guys, Timmy coming back at you, and I went over the pathophysiology of cardiogenic shock, and now what I want to do is go over some of the causes of cardiogenic shock, and then some of the signs and symptoms that you'll see. And again, depending on the kind of shock, when it's related to like hypovolemic or cardiogenic, where blood ain't flowing, a lot of these signs and symptoms are the same. When we get into like neurogenic shock or anaphylactic shock, the signs and symptoms are a little different, but the result again is the same. So in this case, cardiogenic shock, the heart fails as a pump for whatever reason, right? So if you look, one of the big reasons, one of the biggest causes of cardiogenic shock is a big old MI, left ventricle. Bam. Aortic stenosis. So you got your little left ventricle here, and then coming off your left ventricle, you got your aorta. That aorta can become narrowed. And as a result, that left ventricle has got to try to really generate some pressure to try to get that blood through that narrowed opening, and that can lead to failure. The other thing is cardiac tamponade. If you remember, and I'm not the best drawer, I'm doing the best I can, these are lungs. And if somebody doesn't like you and they stab you in the chest and then they pull the knife out, it can cause this lung to collapse. And because the heart is in the mediastinum, it can begin to crush your heart. If your heart can't fill, it can't pump any blood. So that's cardiac tamponade. Another cause of cardiac tamponade could be pericardial effusion or hemorrhage, trauma to the pericardial sac, or fluid or blood starts building up in there and crushing that heart. The other thing that can cause it is very fast or slow heart rate. So if you remember, and I know you do, you learned that cardiac output is heart rate times stroke volume. So there's a limit to how big your stroke volume can be. So if your heart rate begins to drop, you can't maintain blood flow. So what causes it? Real slow heart rate. So that's cardiogenic shock as a result of a very slow heart rate. Now, the other problem is, what if your heart rate's real fast? What if it's 250? Well, if you recall, here we go with the little left ventricle again. He's got a little problem there. His left ventricle's on a mountain too. Anyways, if the heart is beating so fast, the blood from the atria fills the ventricle during diastole. If your heart rate is 250, it's clipping along, and there ain't much time for that left ventricle to fill. So the stroke volume is really, really, really going to drop. So that's another cause. And then bad valves, bad mitral or aortic valves. They're stenosed or they're torn. Blood will regurgitate back up into the left atria if the mitral valve is bad, or it'll regurgitate back into the left ventricle if the aortic valve is bad. If it's bad enough, you're not going to be able to feed the coronary arteries if the aortic valve is bad, and you're going to run into trouble. So those are really the big causes of it. And identifying the cause of shock is probably the biggest deal. Once you've identified it, then you know how to treat it. Now look, the signs and symptoms, right? Signs and symptoms, again, the heart fails as a pump. And anytime you lack blood flow to the brain, because you're not being able to pump enough oxygen to your brain, that's going to stimulate the sympathetic nervous system. And the sympathetic nervous system has wholesale changes in the body to try to keep the vital organs alive and no blood flow to them. So they're going to constrict, the sympathetic nervous system is going to constrict the arteries that supply the non-vital parts of your body, arms, legs, skin. So what happens to your skin? It becomes pale, cold, clammy, and nail beds start getting cyanotic. And you got weak peripheral pulses because blood flow is being cut off. Now, when you get a little more technical, you're going to have a mean arterial blood pressure of less than 60. We talked about that when I talked to you about cardiogenic shock in the last video. And if you have a mean arterial blood pressure of less than 60 millimeters of mercury, you're in shock. What caused it was the heart failing as a pump. So if it fails as a pump, cardiogenic, the shock's originating in the heart. As they're going into shock, what does the sympathetic nervous system do? They're confused. They're lacking blood flow to their brain. They're agitated due to the sympathetic nervous system. But as the shock worsens, fatigue sets in. So they will become unconscious. Their pupils will be dilated as the sympathetic nervous system. The breathing initially is going to be rapid. And if you remember, pulmonary edema. Now remember, the left ventricle gets its blood from the left atria. The left atria gets its blood from the pulmonary veins. The pulmonary veins take the blood from the pulmonary capillaries in the alveoli, oxygenate it, and bring it back to the left atrium. So if the left ventricle is failing, the blood is going to begin as the left ventricle fails. Left ventricle fails, that's going to cause backflow of blood in the left atria. That's going to cause backflow of blood in the pulmonary veins. That's why you need to know the circulation of blood through the heart. And then that's going to cause backflow of blood into the pulmonary capillaries. And because capillaries and alveoli are one cell membrane thick, that fluid that's in the pulmonary capillaries, watch it. So if you got a lovely picture here, if you got an alveoli, little air sac, then you got the pulmonary capillary, that pressure is going to start to build up. And it's going to push fluid, water, plasma from the blood into the capillary. That's going to make oxygenation even worse because oxygen has a more difficult time diffusing through water into the blood. And that's also, they're going to start retaining CO2 because CO2 can't go out of the lungs. The result is that they're going to be hypoxic, and because CO2 is building up, they're going to be acidotic. And what does an acidosis do to neural activity? It suppresses it. So that's what causes the nervous system to begin to slowly shut down. The other thing is that when the left heart begins to fail and this pulmonary capillary pressure begins to build up, it's going to backflow, that pressure will backflow into the right heart. Right? Because where did the blood come from? It came from the right ventricle. Then the right atria. Then superior and inferior vena cava. That's why they'll get jugular vein distension. Remember, there's no pressure in the venous system. As a result, when you lay down, that pressure is going to, all that venous blood coming back to the heart is going to distend those jugular veins, and you'll get JVD. Jugular vein distension. Jugular vein distension. And, watch it, blood flow drops. Remember, one of the indicators of blood pressure or cardiac output, blood flow, is urine output. So as the blood pressure begins to drop, their mean arterial pressure begins to drop, they are going to get low or no urine output. That's also going to activate the wonder twin powers of ADH and the renin-angiotensin aldosterone system. So it's a vicious cycle, and these people go out of control rapidly. So if they're going into cardiogenic shock, what do you want to do? Well, you want to support their breathing. So in this case, you may have to intubate them and put them on mechanical ventilation, and you may have to try some what's called PEEP. I'm doing this on the 4th of July, so at Easter, you get those little, remember those little candy PEEPs? And what you do is you stick them down the ET tube. That'll help them. PEEP is positive end expiratory pressure. What that does is as the breath is coming out of the patient, the machine puts a little positive, a little air back into it to kind of keep those alveoli from deflating and to push some of that fluid back into the bloodstream. So that's one of the reasons you get PEEP. But initially you want to be able to try and oxygenate them and remove the carbon dioxide. The other thing, now think about it for a minute. The heart's failing as a pump. So what do you want to do? You want to make the heart pump better. So how do you make it? You give them positive inotropic agents. Inotrope means force of contraction. Positive means it improves it. So there are drugs out there called dobutamine, dopamine, norepinephrine. These guys are okay if the blood pressure ain't so bad, if they're hanging in there. Norepinephrine or Levophed is a drug that's given like as a last-ditch effort. Their blood pressure is bottoming out. We got to do something. Because norepinephrine is also going to cause constriction of the arteries. So if the resistance to arterial blood flow goes up and your left ventricle is failing, what's the point? Dobutamine and dopamine, they don't have as great of effect on the heart in terms of increasing heart rate. But they'll increase renal perfusion and they will increase the force of contraction of the heart. Now, again, you got a bad heart, you got a bad left ventricle, have big MI. Do you want to try to pump blood through arteries that are this big or this big? A or 2? Well, hopefully you said 2. So you want to give them vasodilators. And there's newer drugs out in the last, maybe 10, 15 years, 20 years, called Amiodarone and Milrinone. And basically what they do is they are positive inotropic agents, so they increase the force of contraction of the heart, but they're also vasodilators. So you are going to increase the force of contraction of the left ventricle, and you're going to reduce the resistance that left ventricle has to push against. And that's ideal. So these are really kind of the first line drugs if you can get a blood pressure on these people. Because, watch, according to Ohm's flow law, which you know and love, systolic blood pressure over resistance. If your resistance increases because the arteries get smaller, then your systolic blood pressure has to increase to try to maintain blood flow. Well, if your left ventricle is jacked up, it ain't going to be able to develop that pressure, and that will worsen the shock. So you want to cause the arteries to dilate, right? So you reduce the resistance, right? So you give them a vasodilator, and then you give them a positive inotrope that will increase systolic blood pressure. So if you drop the resistance and you increase the force of contraction of that left ventricle, that's going to increase blood flow and Q. Yeah. Now, if they're a mess, right, then you have to have, if you have time, inserted what's called an intra-aortic balloon pump. And as the name implies, it is a pump with a balloon on it. I mean, cut it out. And what it does, I'll explain in a minute. Hang on, it's coming back. There it is. So watch. What you have here is you stick a long catheter usually into the femoral artery, and it's connected to a machine, and on it there is a balloon, and based on the person's EKG, the balloon inflates. I'll show you the video in a minute. This balloon will inflate during ventricular diastole. So when the left ventricle is relaxed, that balloon inflates. And when it inflates, it pushes the blood back towards the heart and down towards the cells and up to the brain. So that increases perfusion of blood. The other thing, which you know and love, you learned that during left ventricular diastole, when the left ventricle is relaxed, the aortic valve is closed, and the coronary arteries come off the base of the aorta. So if somebody has ischemic heart disease or lacking blood flow to the heart muscle, when you put the intra-aortic balloon pump in, and when that balloon inflates during diastole, it not only sends more blood flow to the brain through the brachiocephalic, the left common carotid, and left subclavian, nice, not too, but it also increases coronary blood flow. The other thing, when the balloon deflates, so watch, I'll show you a little video here. When it inflates, it's going to push that oxygenated blood to the brain, also perfuse your coronary arteries, which you want, and then send more blood, pushing that blood, because that balloon is taking the place of the blood that was in the aorta, so that blood's got to move, and it's going to move up and down, and that's going to increase blood flow to the vital organs too. And this also gives the heart a chance to rest. So watch. So when the left ventricle is going to contract, the balloon deflates. It's going to deflate. You watch. Right? So now it deflates, and that is going to allow the left ventricle, when it contracts, to push against less resistance. Right? Because the balloon was taking up the space. Now the balloon deflates, so there's more space for that blood, so that will lower the resistance to blood flow. So basically what the left, or the intra-aortic balloon pump does, is it makes the heart, left ventricle, have to work less, and at the same time increasing blood flow to your brain and vital organs. Blood flow increases to the brain and vital organs when the balloon inflates during ventricular diastole, and the resistance decreases when the blood deflates, so the left ventricle doesn't have to generate as much pressure. So it gives the heart an opportunity to take a little break. Now, if that ain't going to work, your last option is what's called the left ventricular assist device. This is a surgical procedure. Basically, it is a small pump that's inserted at the apex of the left ventricle. And what it will do is it will draw oxygenated blood that's in the left ventricle, that weakened left ventricle. Hang on. It's going to draw it into this little pump, this little drive here, and then it's connected to the arch of the aorta, and it will pump blood to the brain and vital organs. So it will take some of the workload off that damaged left ventricle. Now, in some cases, this is typically used as a bridge to transplant, to keep these people alive until they can find a donor heart. In some cases, they will actually implant the left ventricular assist device where no donor is available, and these people will live the rest of their lives with it. The battery pack in this pump is relatively small, so it's kind of like they carry it on their, you know, around like a, I don't know, like a book bag. But you guys don't carry book bags, do you? Just playing. All right, so that's really cardiogenic shock, the signs and symptoms, some of the medications used to treat it, and then also some of the surgical interventions for cardiogenic shock. All right, hope that helped.